Trauma Therapist Podcast Plus listeners can listen to episodes early and ad-free right now. Become a Plus listener by going to Apple Podcasts, searching for the Trauma Therapist Podcast, and signing up today. Welcome to the Trauma Therapist Podcast, a show about the incredible people dedicated to helping those who've experienced trauma. My name is Guy McPherson, and my mission is to raise the awareness of trauma and to inspire each of us to help those around us. All right, Glenn, here we go. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the podcast. I am thrilled to have back Dr. Glenn Doyle. Glenn, welcome back.
It is a thrill and a pleasure to be back with the master of metaphor himself, Guy McPherson. You guys don't know, like right before we came on, I said, Guy, how have you been? And what did you say? You said, I'm juggling the flaming machetes of life.
That's it.
If only I had that kind of facility with metaphor just off the cuff. I'm always impressed with you, my friend. It's great to be back. Thank you for having me.
Appreciate it. Well, as you folks will remember, Dr. Doyle has extensive clinical experience in inpatient, outpatient, and consultation settings. He's presented multiple times at the annual conference of the International Society for the Study of Trauma and Dissociation and the American Psychological Association. Dr. Doyle got into psychology because as a teenager, he became deeply fascinated with the self-help movement as well as literature. And as a professional, has made it his mission to bring the techniques and research base of clinical psychology to the personal empowerment paradigm of self-help. Dr. Doyle is also the board president of the organization Seek Safely. We'll be talking about that today. Glenn, remind our listeners before we get going here where you're from originally and where you are currently.
So where I'm from originally, I was just talking with somebody about origins. No, this is interesting. So no, I grew up in the Midwest. I am from Iowa. I did eventually I did my undergraduate at the University of Missouri, Kansas City. But I think as we talked last time, it was kind of a circuitous route to to graduating with a psychology degree. But no, I went to undergrad in Kansas City. Then graduate school in Washington, D.C., where I worked for like the first few years of my career. I was the unit psychologist at the Center Post-Traumatic Disorders Program at the Psychiatric Institute of Washington. Under the supervision of folks you know, Christine Courtois and Joan Turkis. Then I came out here in my own practice. I'm currently in Chicago. Sweet home, Chicago, in 2015. But I started, here's the whole thing. Like I started my college career. I think we talked about this before. I was going to be a rock and roll star. I started as a music major because I really liked the idea of, you know, as soon as you're done with your job, a bunch of people stand up and go, yay, more. Wanted that, but was not to be. Anyway.
One of the things I wanted to talk to you about is I follow you online, and I want to talk to you about your posts and the energy behind them. And there's a sense of advocacy about them. There's a strong sense of advocacy about them. And I don't know if it's bordering on social justice, but there's a strong sense of empowerment and self-worth, and the oftentimes lack of self-worth a lot of us feel. This makes sense? Am I resonating? Correct me if I'm wrong.
No, I mean, first of all, thank you for noticing. I think, Guy, what you may be detecting is the fact that my approach to this work, it's never about us and them, like us clinicians and them patients. It's always about we survivors. We might have talked about this a little bit the last time I was on, but my entire approach is about, look, this is not so much about trauma therapy. This is about trauma recovery. And I take a lot of my approach to the work from concepts that I was first really exposed to in addiction recovery settings. So I myself am an addict in recovery, and I think that we need to approach recovery from trauma as well as a trauma survivor. And I think we need to approach recovery from trauma in much the same way that the addiction recovery tradition talks about addiction recovery. It's not a matter of we figure something out, we have a breakthrough, and we're good. We are always in recovery.
Right.
Right? Like we wake up every morning and we have to choose recovery again. So a lot of what I write in terms of we, because again, it's not just a signaler of solidarity with our patients. I write we because it's we. We are all in recovery. Now, therapy is frequently a useful tool of recovery. It's not the right tool for everybody at all times. But I think that we can really get lost in this idea that, man, if we just meet the right therapist and we just do the right piece of therapy work, we're going to hit this plateau and we'll have an insight, and that's going to be it. No, we need to work our recovery. It's not even a matter of like we figure something out. We work our recovery. Like my approach is all about rituals and skills and habits and how we work a recovery day by day. So, I mean, I think that might be a piece of kind of what you're picking up on, because when I write, I'm very frequently talking about myself, but I also don't put something out there that I don't think is broadly useful to the recovery community.
But I think when people hear trauma therapy and recovery, there's an understanding of general understanding maybe of what each of those mean.
Yeah.
But when we're talking about trauma, what do you mean specifically? I mean, you said a little bit about, I mean, there is that idea, right? We need to find the right therapist. And if we get in tune with the right treatment, things are going to gel, and there's going to be, the angels singing. I mean, there's that hope, but you're saying something different here. Let's get more specific.
You bet. So psychotherapy, I'm going to make some therapists angry with this podcast. I'm just letting you know, this is the Trauma Therapist Podcast. I'm going to kind of trash therapy a little bit. Not really. I'm a therapist. I think therapy can be a beautiful tool when it's the tool. Like when it's the tool that's the right tool at the right time for the right person. That said, therapy broadly has a story tradition going back to the psychoanalytic guys. And yeah, a lot of them were guys. But going back to, the psychodynamic origins of what we in the West think of as psychotherapy, there was this idea. So Freud had this idea that, man, there's stuff we can't handle, so we repress it, right? And that repression causes anxiety. So we develop all these symptoms. And the only way that we can get rid of these symptoms is to go to an analyst. And the analyst is going to kind of help us put together the pieces of what we have chosen to not know. We've unconsciously chosen to not know something. So we're solving a riddle or a mystery within us. We're making the unconscious conscious. Remember that from Freud? And it necessarily put the analyst or the therapist in a position of kind of this Merlin-like wizard of like, oh yeah, man, I've got the magic words that are going to unlock this mystery inside of you. And then the idea was, once we resolve these inner conflicts, or we know what we already know, but we've decided not to know, right? Then our symptoms kind of disappear. Because again, why do we have symptoms? We have symptoms because of the anxiety caused by repression. There's still a lot of therapists that operate on this paradigm. This idea that you see him on Twitter. Speaking of Twitter, you see him on Twitter every day. This idea that therapy is all about, we come to know ourselves on this deep level and whatever. And again, there's a place for that kind of work. However, I find that when we're talking about trauma survivors, and we talk about the challenges and the struggles that tend to bring people into therapy for specifically to work on their trauma, it's not, generally speaking, because we have some riddle inside of us that we're struggling to solve, and we need somebody in a position of authority to kind of this wise person who is solved their own conflicts to help us solve that riddle. What's happened is we've been through things that have damaged, often physically, our nervous system. I write a lot, I speak and write a lot about trauma conditioning and trauma brain, right? Especially when it comes to complex trauma. We've had conditioning experiences every day of our lives for a lot of us, and almost all of the important relationships of our lives. That's what makes complex trauma complex, right? Happened over time and in our relationships and stuff. It has conditioned us in certain ways of thinking, feeling, believing, behaving, right? And that's not the kind of thing that goes away with having an aha moment.
Right.
Let me ask you this. How many times have you had a moment where you've realized, boy, this behavior is not serving me, and I kind of know what it's about. Like I kind of realize, and yet I still do it. Almost everybody who's ever had an addiction of any kind, whether we're talking about Diet Coke or crack cocaine, has had that moment of, I don't think this is serving me, and I kind of understand it, but it's still a pattern. It's an ingrained conditioned pattern of thinking, feeling, behaving, responding, et cetera, et cetera. So I think in working with survivors, we need to cop to the fact that, look, there's not going to be that aha moment. Look, there are going to be plenty of aha moments, I guess, right? Like we're going to have plenty of moments where we have, moments of insight. Oh, that's connected to that. Great. But still, when it comes to protecting our safety and our stability and improving our quality of life, what we're still talking about is on the daily, how are we reconditioning ourselves? How are we starving those old neural pathways that led down those pathways? We all know them, right? That made us miserable and that got us into trouble, et cetera, et cetera. How are we starving those, letting those roll over? And how are we creating new pathways through the jungle of ways that, things that we can think, feel, believe, and do that create a higher quality of life? And again, it's not, think of it this way. I can talk to a cartographer, somebody who makes maps, and they can say, look, if you just go this way instead of this way, it'll get you there much faster. Aha moment, right?
Mm-hmm.
The conversation with a cartographer doesn't help me a whole lot if I'm still on the ground trying to get from one place to the other place, and the one path is like really well traveled, and it's a super highway and it's paved, and blah, blah, blah. It makes me miserable, but I know how to do it. The path is still a jungle path, right? Doesn't matter if I've had the aha moment with the cartographers. Yeah, just go this way. It's fine, right? I still have to hack my way through the jungle. That's what recovery is. So yeah, I'm using metaphors now. See, check that out.
So to be clear, you actually said this. You're not discounting the value of therapy or therapists not at all. I just want people to hear that because it's very easy. So for those therapists who are listening to this, as well as the survivors, okay, what you're saying makes a lot of sense. What does that mean in terms? Does that mean I need to do something else in addition to seeing my therapist? Do I need to suddenly cognitively approach this as recovery? And if so, what does that mean specifically?
Sure. I have lots of thoughts about this. First things first, I think all of us therapists need to be very real about the fact that we get such a limited crack at our patients every week. Like we get a very finite slice of their time. And by the way, we get one version of them. We have to be real about the fact that we're not the most important influence on them. And by the way, if we are, that's probably a problem. Okay. It's not a matter of should our patients do something in addition to therapy. They are doing things in addition to therapy. I often remind folks that, look, recovery, both from addiction and trauma, has been around long before therapy, and it'll be around long after therapy is no longer a thing. I guarantee, like in 100, 200 years, this thing that we call therapy won't even be a thing anymore, right? Trauma recovery will still be a thing. How does it change how we work with our patients? the first thing that I would recommend is, to the extent that you can, as a therapist, get a as holistic a picture as you can of what their overall recovery looks like.
Mm-hmm.
Because again, like this idea that the only thing operating on them are the ideas that we give them or the work that we do with them. Not only is it not accurate, right? It's also not trauma informed. Trauma informed work necessarily centers the survivor. And one of my problems with kind of very traditional therapy is it places the therapist in the role of expert. It creates massive power differentials. It also tends to privilege again, kind of what the therapist says or the intervention the therapist does instead of centering the survivor. All of which is not trauma informed, right?
Mm-hmm.
All of which can actually exacerbate the symptoms and the struggles of your typical survivor. So what I think you should do to take a recovery mindset as opposed to a therapy mindset, get as holistic an idea as you can of what their overall recovery picture looks like. And then ask yourself the question, like, look, me as a person who gets maybe 55 minutes, like most of my folks, I get 55 minutes, maybe 110 minutes if I see them twice a week, right? In that very finite period of time, how can I move the needle in their overall work?
Mm-hmm.
Let me use another metaphor, since I'm inspired, since I'm talking to Mr. Metaphor here. I think of recovery as so I'm a fan of mixed martial arts. The fights, they have 5-minute rounds, and in between the rounds, they come back to the corner.
Mm-hmm.
When they come back to the corner, the corner crew, they've got 1 minute in that corner, and the corner crew can kind of clean them up and give them some feedback and what they're observing and answer some questions, and then they're back out into the fight.
Right.
Recovery is the fight. We can't be with them for that. We wish we could, but we can't. And the fight, the time that they're out there in the ring and the octagon, dwarfs the time that they are back here in the corner. Think of your therapy sessions as, look, you've got them in the corner for a minute.
Mm-hmm.
You've got to pick and choose what you're going to use your minute for, right?
Right.
What observations are most important, how you can best clean them up, right? What they most need to know, be responsive to what they're saying in that minute. So it's a perspective shift. And I know some therapists, again, most of the therapists that I know, that I personally know, are amazing at what they do, right? However, we've all heard stories, horror stories, of therapists who truly thought that they were running this. Mm-hmm. They truly thought that they were running the patient's recovery, right? You're not. And by the way, if you were, that's a problem.
Right. So when you speak of recovery, how are you defining recovery? Because you're saying that the client is with the therapist a very finite portion of time, and they're in recovery the rest of the time.
Oh, no, they're in recovery at all times.
All times. Okay, but does recovery mean the intentional actions taken in a particular direction towards healing, or what does it mean?
So recovery, as I use the term, and again, I encourage you to think about it as analogous to addiction recovery. So when somebody says, I'm a recovering alcoholic, or I'm in recovery from substance addiction. So I personally am in recovery from substance addiction. What that means is it has a couple implications. One, it has the implication that this is not a quest for an outcome. Like, it's not like I'm going to get to the point of being recovered. I'm in recovery, right? That's important because it necessarily implies that it's an active process that I'm choosing every day, as opposed to I'm waiting to heal. Like, I have a big problem with when people say, well, in order to heal, you do this. And I understand what they mean when they say that, but I'm not waiting to heal. I'm working my recovery, right? Mm-hmm. Think about recovery as a lifestyle. Okay. I live a recovery lifestyle. What does that mean? That means every day I have to wake up and choose it, right? We choose our lifestyle. I distinguish that from, say, just things that happen to us, right? Okay. Things that happen to us are not part of our lifestyle. Our lifestyle are the things that we choose. So I think of recovery as a lifestyle. I also think of recovery as a mindset, right? So in cognitive therapy, they talk a lot about schemas. Schemas are these broad beliefs that we have that filter incoming information, right? Like we have these beliefs that causes us to pay attention to some things, not pay attention to other things. Recovery as a mindset or as a schema, if you will, is very similar. Like if I'm looking at the world through a recovery mindset, I'm always asking myself the question, okay, so this stressor that's happening, how does this interact with my past? How does this interact with my symptoms? How does this interact with my vulnerabilities? Right? The reason why that's important is because, as you know, one of the biggest problems experienced by most survivors, the world is full of triggers. The world is full of triggers and has very little patience for our trauma responses. Mm-hmm. So something that we necessarily need in a recovery mindset is the fact that whenever anything happens to us that is remotely stressful, we necessarily ask ourselves, okay, does this have the potential to trigger me? What is this going to interact with? What knowledge, skills, and philosophies do I need to engage right now to deal with this? And some people say, like one part of the pushback I get to my approach sometimes is like, ugh, I don't want to think about trauma all day. Are you kidding me? I've got to think about everything from a recovery mindset. Oh, come on. Maybe I think about like work, but I'm off the clock, right? Like I don't think about that. Think about how nonsensical it would be for an addict to say that.
Right.
Yeah, I'm in addiction recovery 9 to 5, but then after 5, I'm taking it off, right? No. We have to be in recovery like we're in recovery. It's a 24/7 project. We're also in recovery. You raise an interesting point. Say, look, are we in recovery in the therapy hour? You betcha. Because the stuff that happens in the therapy hour also interacts with our past, with our symptoms. We also have to manage stressors and triggers that come up in the therapy hour and vulnerabilities that come up in the therapy hour, right? It's the height of trauma uninformed work to say like, well, okay, so this is the therapy hour. I'm the therapist. I'm going to handle that for you.
Right.
Well, no, the patient, the survivor is always in recovery, always looking at things through a recovery mindset.
What I like about what you're saying, Glenn, is you're kind of switching the power, if you will, into the client's direction, center, into their core. And in the whole trauma field, in the whole therapy field, as you were talking about, there's an imbalance. There's an implicit, inherent imbalance with the therapist up here, the client down here. The therapist in most cases done all this work, gone to school, spent all this money, has all this knowledge, and is going to impart that, oftentimes with the best of intentions, onto the client. But it subtly, sometimes, maybe oftentimes, subconsciously, unconsciously shifts the power away from the client. That's what I was sensing in a lot of what you post. And it's very different from what a lot of other people are posting. But this idea that, oh my God, what I gotta do this every day. It's a different schema. It's a different paradigm that you're talking about.
You bet. I would really like to see trauma recovery treated culturally a lot more like addiction recovery. And don't get me wrong, the culture has problematic attitudes toward addiction recovery as well. But what I mean when I say that is in any city in the world, at any hour of the day, I can find a 12-step meeting. Now, 12-step is not a perfect approach, and I don't entirely endorse 12-step. That's not what I'm saying.
Right.
The parts of 12-step that I do really like is the fact that, one, there's a lot of availability of resources that are free. There's an ecosystem built up around sponsorship and mentorship that I think is really important. Think about the fact, Guy, that in our field, I don't know if trauma psychology, maybe it's just the fact that because I'm in the trauma psychology sphere, that I'm just more aware of this in our field. our subfield of psychology. But we spawn gurus like nobody's business. Are you kidding me? Like if you asked, who are the big trauma guys these days, right? You'd know, right? Like
Right.
it's Gabor and it's Bessel and it's like all these guys. It's Glenn, right? All these guys. Um, it's the opposite of, ironically, it's actually the opposite of what trauma informed means. Trauma informed necessarily takes the power differential down a notch, specifically because what are the dynamics that contributed to complex trauma? Massive power dynamics that fed into feelings of helplessness, hopelessness. Like complex trauma doesn't happen 99% of the time, doesn't happen without a massive power differential. And yet, ironically, somehow we ended up being like the subfield of psychology where we've got these gurus. Like, what are we doing, man?
Mm-hmm.
So I'd really love to see, again, more people think about recovery as survivor focused. And again, kind of analogous to addiction recovery insofar as, we work the steps, we work our recovery. The other thing that occurs to me that I really want to say before we run out of time is the fact that I can tell you as a recovering addict, the days and the nights are hell. The nights especially are hell. There's not a day that I don't think about using. Now, I'm at a point in my life and in my recovery where I've got a lot more skills, tools, philosophies, and other resources to handle that. But I'm still at risk. I'm still vulnerable. That's another key part of recovery: is never underestimating our risk, never underselling our risk and our vulnerability. Trauma, the experience of trauma, as you know, as I know, as every survivor listening to this knows, is very similar to addiction. Insofar as the days, the nights are hell. There's not a minute of most days, and there's definitely not a minute of most nights that survivors are not struggling in some way, shape, or form. And yet, we've constructed a therapy paradigm where we're expected to do this work in session and then do what? Press pause?
Mm-hmm.
This is a 24/7 struggle that we have with trauma. Therefore, we need a 24/7 solution. That's why I talk about recovery instead of therapy.
Yeah. I sense a book. I feel a book. With all seriousness, I mean, it's just interesting when in doing these podcasts and doing these interviews, not too many people, I don't even know if anyone else is talking about it the way you're talking about it. And I love it. I love it. Look, I want to mention your position with Seek Safely. Can you say what you're doing with that? What is Seek Safely?
You bet. So it's apropos that you mentioned this because you discussed at the top of our time together that I got into this field because of self-help. I was a self-help guy. One of the reasons why I'm still a self-help guy, and don't get me wrong, the self-help field has problems, but one of the reasons why I'm still a self-help guy is specifically because of my commitment to recovery, right? Almost always when your patient comes in, and we all know that like trauma survivors as patients tend to be super well read. We're usually not their first stop. They've usually read books. They've usually done like online resources, et cetera, et cetera. Seek Safely is a nonprofit organization dedicated to advocating for ethics and accountability in the self-help industry. It was actually founded by the family members of people who died doing self-help retreats that were led by a really unethical, really scummy guy. Like you can look up this entire story on the internet. But my point is that what we at Seek strive to do is to educate, empower, and in our way protect consumers of self-help literature and resources from those that would seek to exploit their vulnerability. So as a practical matter, we have the Seek Safely podcast, and that's hosted by me and Gene Brown, where we discuss exactly these issues. Whether or not you're a survivor, if you're somebody who is struggling, suffering, vulnerable, and you're accessing self-empowerment resources, self-help books, classes, seminars, like whatever it is, you need to be really mindful of what makes for good quality ethical self-help, and where there might be signs of exploitation. I find that our mission is really resonant with a lot of survivors because, again, survivors make up such a big subset of the audience for self-help products and services. So we're at seeksafely.org. We have the Seek Safely podcast. Do a flyby of us if you're somebody who consumes these resources. We aim, just like I am on my social media presence, we aim to put out stuff worth thinking about in this journey.
Awesome. I'll have that linked up here at the show notes page at the traumatherapistpodcast.com. Glenn, what is the best way for people to reach you, find out what you're doing?
I'm on all the social things at Dr. Doyle Says. Generally find me at Glenn Patrick Doyle is I throw my middle name in there because Glennon Doyle also exists and puts out self-help material. What are the odds of that, by the way? What are the odds that two people would exist with a virtually identical name in kind of the same niche? But if you Google Glenn Patrick Doyle, but on Twitter and Threads and all the things, I'm at Dr. Doyle Says.
All right. Awesome. Glenn, thank you so much for coming back. You're welcome anytime. Super inspiring. Really appreciate it.
It is my pleasure, and we'll come up with more amazing metaphors the next time.
All right, man. Take care.
Take care.
Bye.